Do you ever wake up in the middle of the night with cramps in your calf or you have calf pain? If so, this could be coming from trigger points in the gastrocnemius muscle. Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the gastrocnemius muscle. Before I begin, I want to speak a word of life from Colossians 2:8. See to it that no one takes you captive through hollow and deceptive philosophy, which depends on human tradition and the elemental spiritual forces of this world rather than on Christ. So if you've got calf pain or you have cramps in the middle of the night, it could be a sign, or it could show you that you may have trigger points in that calf muscle. And if you do a lot of repetitive plantar flexion of the foot, so if you're pointing your foot, pushing off constantly, such as with running, walking uphill, or anything where you're pushing down and activating that muscle, you could develop trigger points. Its origin, insertion, it's got two heads. It's the most superficial muscle on the back of the lower leg, so it's that one that you can see when you are going to bend your knee, so it is going to bend the knee too when the foot is not on the ground, and then it's going to push off and activate the muscle with that movement of the ankle. And it's going to attach to the medial lateral epicondyle of the femur. So there's two bony parts that flare out when you get close to the knee. That's where it attaches. And then the outer portion, the lateral gastroc, so the outside head of the gastroc is also going to blend in with what you call the arcuate complex on the outside of the knee, which is going to blend into the meniscus, which is the cushion in the knee. So if there's knee problems, this muscle is sometimes involved because it's got a direct attachment to that structure. So if you have pain that's also on the back side of the knee, this can be coming from the gastrocnemius muscle. What I'm going to do to address the trigger points is I'm going to work higher up in the back side of that lower leg. Now the attachment is going to blend and it's going to converge onto the Achilles tendon. So the soleus and the gastrocnemius are both going to converge on that Achilles tendon that attaches to the calcaneus, to the heel bone. So I will use a single lacrosse ball, and I'm going to go just behind my lower part of my leg, a little bit up high. So I'm just right, there's a fossa, so it's right behind the knee. If I come down just a little bit, but I'm going to be on that upper portion, I'm going to go right in that area, and then I'm going to work my way to the medial head. So I'm going to work my way to the inside, and then I'm going to work my way to the outside. Similarly to the soleus, except I'm going to be up higher on the lateral and medial heads. They are different muscles. I'm going to put as much pressure down into that area as I can, and going medial side to side. And then if I feel an area that feels like it is tender or it has more tension, I'm going to hang out there and hold it for about 20 or 30 seconds. And I can mobilize my ankle as I'm doing this. Now, if you've got trigger points in the calf muscle, it doesn't necessarily mean that you're going to lose range of motion, so mobility in the ankle, but it can affect the pain pattern, and you can feel pain in the calf, in the back of the knee, and again, you can get cramps at night, and you can develop trigger points, again, like by pushing and constantly plantar flexing that foot, but also you can develop trigger points in the calf muscle if there's poor circulation in the leg, so that can contribute as well. So I'm just going to mobilize, and I'm gonna lift my body weight. So I want to put as much pressure down into those areas as I can. I find that I get more effectiveness in the trigger point release, as well as releasing the fascial tension that wraps around the muscle. And fascia is just connective tissue, and it wraps around the muscle fibers, the muscle belly. So I'm just applying pressure, and I'm going side to side And I'm going to do that until I can feel a change. So I'm looking for the change, and I'm looking for a reduction in the tenderness and the tension in that muscle. And I want to go slowly. So once I find it too, you want to go really slow. Rule of thumb, if you feel like you're going slow, go slower. And once I work on those areas, I can then stretch that muscle. To stretch that muscle, I'm going to keep that leg straight when I push my heel back, and I should feel the stretch right on the back of the calf there. After stretching it, if I want to then strengthen the muscle, I'm just going to go up onto my toes, hold that for about 5 counts, coming right back down and going right back up. And I can do that 3 sets of 12 and challenge myself in different ways to strengthen that gastrocnemius muscle. But that is how you can address the trigger points, stretch the muscle, and then strengthen it. And what you're doing is you're just trying to restore that muscle-tendon relationship so that the muscle is functioning and working the way that it's intended to. So I hope this is of help, and have a blessed day. Thank you.